what makes community health centers such incredible training grounds for physicians.
That's one of the unique things we want to talk about today is our residency programs and the work we've done there.
So when these physicians graduate, they go on into practice and they implement what they've learned here.
We are fully not only willing, but able to train tomorrow's workforce to successfully work in that environment.
In this episode of Community Health Centers Unfiltered, we have the opportunity to speak with several leaders on the front lines from Rio Health, the largest community health center in Arizona, to discuss the future of physician training through the Teaching Health Center Graduate Medical Education Program, the Teaching Health Center program. Rio has been a national leader in developing community-based residency programs that train doctors where they're needed most, serving diverse and often underserved populations. When asked to grow the healthcare workforce, Rio answered the call, but today, those programs are at risk. With federal budget cuts and the uncertainty of year-to-year funding, Rio's physician residency program and others like it across the country face challenges that could jeopardize the pipeline of primary care providers. Our guests today share how these programs changed lives, why they're vital to addressing the nation's physician shortage program issues, and together we look at the unique value of teaching health centers, the real-world impact on patients and communities, and the advocacy needed to ensure that the future generations of physicians are trained in the communities that need them most. I'm really excited for this conversation. These folks are doing the hard work on the ground, and they are a perfect example of the impact and the power of the Teaching Health Center program. So with that, let's get started. Hi, everyone. I'm Amanda Pears Kelly. I'm so excited. This is Community Health Centers Unfiltered. I am joined today by a really wonderful team from Rio Health Center in Arizona. The conversation is going to be extremely rich and so important in terms of this moment in time, but also just the role that health centers play in helping to build the healthcare workforce, but also what's at stake. So before we dive into this conversation, I want to welcome Clint Kuntz, who is the CEO of the health center, to introduce himself and, of course, hand it off to his team members to do the same. So Clint, can you introduce yourself for us?
Thank you, Amanda. I really appreciate you allowing us to be here and talk a little bit about ourselves. So, I'm Clint Kuntz, CEO here at Rio. I've been here for 3 years now. Rio is the largest provider of primary health care in all Southern Arizona, not just as an FQHC, but all primary care across all Southern Arizona. We're one of the largest health centers across the nation, and we provide, all services like all health centers do. We also provide a lot of other unique services, not just in the health center world, but just, I think, unique you'll find anywhere. We have unique programs around pain and how we approach that, and just a lot of unique programs, and especially around residencies. And I think that's one of the unique things we want to talk about today is our residency programs and the work we've done there. And so with that, I want to turn it over to Dr. Spegman to introduce himself.
Yeah, thanks, Clint, and thanks, Amanda. Just really welcome this opportunity to talk with you. So I'm Doug Spegman. I'm an internist by background and chief clinical officer here at Rio. I've been blessed to be here for about 31, almost going on 32 years. Came through the U.S. Public Health Service, National Health Service Corps, and did what was intended with that program. I stayed on. And I'm just in that light, really excited to talk about how we as community health centers build the health force for tomorrow, build that workforce from the communities to meet our needs. So very excited to talk about that. And let me introduce you as well to Dr. Felipe Perez.
Thank you, Doug. Amanda, a pleasure to be here today. Felipe Perez, I'm a family medicine physician by training. I've been with Rio for about 16 years now. And I'm just very grateful to be here. Just like Dr. Spegman, similarly, I came to Rio as part of the National Loan Repayment Program that was paid off, and I stayed, and very happy I did.
Oh my goodness. So I didn't realize that I was going to be in the midst of 2 National Health Service Corps alumni, and there's lots to talk about on that front too. But thank you guys, both of you, for your service, and Clint, to you too, because while you've been at Rio for 3 years, you've been in the health center world for a lot longer than that, decade.
Almost 20 years.
I was going to say, I know it's been a long time, and the work that you're doing on the administrative, but also on the clinician side is just so vitally important. But I know before we even dig into the conversation, which is going to be about the Teaching Health Center Graduate Medical Education Program, you guys created this incredible video that I want to take a minute and watch, just because I think it brings such incredible color to the conversation that we're going to have today. So let me just take a minute and we're going to watch that right now.
Rio Health is the largest community health center in the state of Arizona. Part of our mission is to train our workforce here in the community from the community.
I'm definitely going to be staying in Arizona. I grew up in Arizona, went to U of A down the street.
I grew up in a rural and underserved community of Douglas, Arizona.
Born and raised in Arizona, and I'll die in Arizona.
We started 2 residency programs, one in family medicine, one in psychiatry. We were awarded a letter of support that we were going to get funding from the federal government. And we're so proud that we have onboarded these residents, and they're currently working as we speak in the community.
For me, working for an underserved community is important. That's basically why I studied medicine.
I chose something like El Rio because I was really interested in being kind of boots on the ground, if you will.
Being able to serve the needs of everybody is something that I've always been passionate about.
It kind of serves the same population like the one that I grew up in.
There's other programs in the nation similar like ours. They're doing great work, but the funding isn't there. We were all promised federal funding, which never happened.
We see everyone, no matter who you are, no matter your background, and that's kind of very unique to El Rio. There's very few other centers that do anything even remotely close to that.
I want to go back to my community or a community like Douglas to be able to give back.
I love working in this kind of environment. And if all things were equal, this is the kind of place that I want to train at for my whole career.
Population I see, I would love to have continue to be a part of my practice. Those who are underserved, Spanish speakers, and those who feel like, they might not have had a voice in healthcare before.
There are very few opportunities like this. There are maybe a handful of centers that are like El Rio in the country. We're the only one, to my knowledge, in the state.
When asked to grow the healthcare workforce, Rio Health answered the call. We're proudly training the next generation of physicians, dedicated young doctors who represent the future of American healthcare. But without the federal support that was promised, this impactful program is at risk. We urge you, help us make America healthy again. We're asking that community health centers like Rio Health be included in the Teaching Health Center graduate medical education budget. Thank you for standing with us and supporting the health and well-being of our country.
Okay, we've done that. Now we can actually dig into the conversation. So Clint, thank you so much for introducing El Rio and giving some context to the health center, which is among the best in the country by far, without question, for as long as I've known you guys to work with you. But the Teaching Health Center Graduate Medical Education Program, or the Teaching Health Centers program, as we affectionately refer to it in the health center world, not everybody knows a whole lot about that. So could you just take a minute to speak to what that program is and what makes community health centers such incredible training grounds for physicians? And I think especially for Dr. Pears and Spegman, where you came through National Health Service Corps, and now this is an add-on to that. I would love to hear from all of you guys. But Clint, maybe you can start.
So the Teaching Health Center, that Teaching Health Center GME program is very unique to the health center program. There's really, 2 ways you train residents, and that's through the GME program in hospitals or this community-based program, and this unique to health centers. It started, several years ago in the health center program, and El Rio has been training residents under this program for many years under consortium model. About 3 years ago, we started our own program, started down that road. We became a sponsoring institution under ACGME, and then we started our own programs 2 years ago down that road to get our own family practice and psychiatry programs accredited, and we've done that. And so I'll turn over to Dr. Pears, who's our DIO, to talk about those programs and where we're at with that.
Thank you, Clint. So I think one of the big differences and benefits is historically in the United States, a lot of the training for doctors has been hospital-based. And a lot of community health centers have not been used to train medical students or any type of residents in the past. And it's very unfortunate because community health centers provide the biggest primary care health force in the entire country. And it's been spaces where we really haven't trained a lot of physicians. And what that has caused is a lot of physicians don't know about the value, about the career opportunities that community health centers bring. And so by moving the training and not having it be hospital-based, but having it be community health-based or role-based, is a lot of medical students see the benefit and they see themselves practicing there for a very long time. And it's just very different. It's very different because one of the things that we focus is quality improvement. We focus on prevention. We focus on reducing ER visits. We focus on reducing hospital admissions. So when these physicians graduate, they go on into practice and they implement what they've learned here. And so really the cost benefits in terms of training residents here, they know the communities better, they know their patients better. It's just all around a huge benefit. And that's why we're here to advocate for this. I'll pass it on to my colleague, Dr. Spegman.
Well, thanks, Felipe and Clint. The only thing, Amanda, that I would add to the discussion is that when you look at where community health centers started way back, they started as an educational benefit to the communities, meaning that back in 1965, under the Lyndon Johnson administration, the community health center movement began with this concept of training clinicians in the communities that they eventually will serve. And through the years, that I don't know if it got lost or it just got blurred a little bit. But the point is now, in this day and age, what we are saying is that who better than us who serve in such a substantial way, rurally, urban populations. It's the federally qualified health centers that are providing the primary care backbone for the United States. And we are fully not only willing, but able to train tomorrow's workforce to successfully work in that environment. And that's why the teaching health center idea was really also an opportunity for community health centers to remember part of their mandate um, to the ongoing health and well-being and social uh, economic factors within our communities that bringing in the next generation really helps with. And so we see this as foundational to who we are.
I couldn't agree more. And I think it is. I think there's the Teaching Health Center program. I think there are incredible, sometimes we use the word homegrown for all of the different education and training opportunities that health centers are providing in a lot of ways out of necessity because there is such a severe workforce shortage, particularly in the primary care space. But I do want to lean in a little bit in terms of the Teaching Health Center program and how it is different. And so, for example, what kinds of specialties and training do you guys provide, and who are the typical residents that come through the program?
Yeah, Felipe, do you want to take that?
Sure. Yeah. So for our training site, we do family medicine and psychiatry, and we've been doing family medicine training since 2013, and that's been a great success. We look for folks who are mission minded, who want to come and serve the community. They want to stay here long term. Those are the kind of learners that we're looking for. People who are willing to go above and beyond and also really recognize and embrace that we need to really address the social determinants of health of our communities and making sure that we leave no stone unturned and we advocate for our patients, we advocate for our community at every level. I will say sometimes we do get students that maybe came to us and really didn't know community health centers before, so they just kind of ended up with us. We did have a resident a few years ago who parents owned a physical therapy company, and he was destined to take over for his family. But when he joined here, he learned the value, what it brought and how it impacted his career. That changed his mind. He said, I don't no longer, thanks mom, dad, I no longer want to take over the family business. I'm going to go work at a community health center. And that's frequently the story is either they join here with their Rio or they join another sister community health center. That's what they're doing. That's what those are the kind of folks that we're bringing in.
And Amanda, if I could just join in the discussion. So it is not the case that what our residency bring is less than what the traditional hospital-based CMS system brings. It's just the orientation is different. So we partner with our local hospitals to give the clinicians the hospital-based rotations that they need. But in the outpatient arena, because we are community-based, setting the curriculum that's community-based, I'll give you a discrete example. We at El Rio have been down this path amongst blood pressure control, hypertension control. And people might think, well, that's a relatively simple thing to do. But when you look at the communities we serve, getting things like blood pressure monitors into the home, asking and having shared decision making, um, tools and abilities with motivational interviewing, assessing how to address not only the patient, but the family and the context that they live in. These are skills that are not easily acquired. And when you look at value-based payments, meaning what dollars go in to really support what drives outcomes to prevent stroke, to prevent heart attack, and in an economic way, to prevent the burden of cost that going to facilities for that care represents, community health centers and trainings that's holistic, that's getting at problems early and really pivoting, getting people from this thought process of what's wrong with you, how do we help you and put a band-aid on it, to say what's right with you and how do we empower you to gain success. And so I brought up the hypertension model. We as a system have been recognized in getting gold recognition from the American Heart Association for our ability to drive blood pressure control to levels that are top decile performance in the country, in the country. And so this is the whole purpose of driving education into the environment where people have to work as a team. Community-based medicine is a team sport. The clinician, the physician is vitally important, but they have to know how to use the resources of clinical pharmacists, of community health workers, of other people within the environment. We have co-located behavioral health services. How do you hand off between, and how do you do that successfully? We have embedded dental hygienists within our pediatric spaces. It's a whole different learning experience that's interprofessional, team-based, and again, is not something easily acquired, but something vitally needed.
So I love what you're speaking to, Dr. Spegman, and it's interesting because this is now the third conversation that I'm having today where the importance of a whole person approach, the importance of care integration, the importance of, yes, the medical clinical, but also all of the surrounding services and needs within the space. And that's what health centers do. That's truly the health center model, and there's proven success with that. But I think in the context of training and education, what you're describing is really special, but so vitally important, especially if we think about the direction of our healthcare system and the transformation that I think is underway right now to really lean into primary and preventive care and to, again, take a more whole person approach. And, when we think through the lens of Make America Healthy again, that's a lot of what is in discussion right now. That's a lot of the framework. And so training the next generation of providers to be able to live and successfully work in that space, what I'm hearing from you and what I completely agree with is there's no better place to do that than health centers who are like you, not just poised and ready, but already underway in a lot of cases. I do want to just pause and pull out the one piece because I think it's so important. Because it is difficult, it can be challenging to recruit and retain providers in underserved communities, whether that be rural or urban. It's a complex population that we are serving. And so for most of the folks that come through the program, the residents, do they end up staying with you, or what does that look like?
Yeah, if it's okay, I'll answer this one. So a couple of features to that. So the answer is that if you look at teaching health centers in general, the vast majority, and I forget the statistic exactly, so I'm just going to give a round ballpark figure, but over 60% of the people who train in a teaching health center remain in primary care serving underserved populations.
Yeah.
And that has been our experience as well, in terms of, if not with us specifically at El Rio, they take that community-based knowledge to other community health centers and or other communities to serve the population that they've been trained to serve at. And then the other thing, Amanda, you didn't exactly bring this up, but when you look at what are the drivers of maintaining the workforce that you do have, when you add teaching to what the work experience is, that also drives satisfaction and sustainability in a very real and palpable way. We follow very closely the metrics of turnover rate. And we've been able to show that because and when we entered into a varied work experience with learners, active learners in the environment, our turnover rates are between 6 to 8% on average, which is very close to best in class. And part of that story is because of the job satisfaction of being a training facility like this.
Yeah, I think that is the story that I hear over and over and over again, Dr. Spegman, whether it's the Teaching Health Center program, but also the National Health Service Corps, and just that the majority of folks who come through both of those programs end up staying either at the health center that they served at or trained at, or in a different community health center or underserved communities. So there's proof there and there's data behind it. But I do want to switch for a second, because so what we're talking about is the incredible success and effectiveness of the program, but the reality is that we find ourselves in right now is that because of uncertainty around funding and budget, it's the impact of that and the reality of what it looks like for the program is very severe. And so I know the video you guys produce really highlights what the impact of that federal funding decision is and what it can mean. But maybe, Clint, can you talk about the current budget situation and just what that looks like for your residency program and the reality at El Rio?
Yeah, so we're in that situation of conditionally funded. What that means is we got a letter from HRSA basically saying, our residency programs were both funded, assuming that they got the funding approved by Congress. So we got letters. It's a very unique situation. The residency programs do not line up with the congressionally funded years. So HRSA understood this and said, you need to go ahead and take your residence. We will fund you when Congress sets their budget. And as you know, we've been in CRs for 2 years straight. Because of this flat funding on these continuing resolutions, HRSA has not gotten their funding upped basically in order to fill these slots. Congress had told HRSA to expand the Teaching Health Center program. They gave them money to do these planning grants and had laid out the framework to expand the Teaching Health Center program. So this has been on everybody's radar, has been on the planning. We've talked to both sides of the aisle. Everybody's for this. Nobody said, we don't like this. We've not heard that from a single lawmaker that we've talked to. So everybody's for it. Just nobody will actually make it happen because of these continuing resolutions. We believe there's 15 to 18 other health centers in the exact same situation we're in. There were 54 contingent funded health centers. Only 15 roughly jumped into the bucket like we did because the funding was a little bit, on the waiver of, well, you need to go ahead and get into the match. And that's a scary situation when you jump ahead and take residence because it's a 3-year commitment. So we did that because it's the right thing to do. And you have to do that when you're going to start a program like this. There's always that risk of starting a teaching program of you don't know that the funding is going to come because you have to start it before the funding's there. It's just the way it lines up, unfortunately, because Congress this year doesn't line up with these match programs. So that's not unusual. What's unusual is the CRs. So the continuing resolution are the unusual piece. That's put us in this situation. We started residence July 1st. We've been funding that out of our own pocket. So that's the unusual piece. So until we get new funding put in place, and by new funding, we mean not just flat funding. We need to actually put funding in place to fund these new residency slots. So if we continue flat funding, that's actually decreases in funding, as we all know, because our costs go up. Everything happens over these past years. All of our costs have gone up. Flat funding is actually decreasing funding. So we need increases to cover that, but also increases to cover these new slots, to train new doctors. Arizona in particular is hit hard, or it's called a 40-40 state. 40% of our doctors are over the age of 40 and will be leaving the workforce very, very soon. So we are in a situation of already being, I think, number 49 in the nation of shortages. So we're double hit on this shortage of physicians. We're trying to meet that need already. And now we get this, we've started residency programs. We're trying to meet the need. There's not a shortage of medical students. There's plenty of medical students out there. So there is no shortage of that. Well, there's a shortage of residency slots to train these medical students and get them ready to, after they graduate medical school, to really get them ready to practice medicine. So we've stepped up. We're really ready to meet that need, train more doctors, not just for El Rio, for the whole community. This is not just meeting our need. This is meeting the need for everybody. And everybody seems to be for that. We just need Congress to really step up to fulfill the promise that was made to us, to our residents, to everybody, to our communities, and not be short-sighted. You can be penny wise and pound, dollar full, because if you don't fund these now, it's going to catch up to us. If you shut a residency program down, generally they will never reopen because it's a 3 to 5 year commitment to reopen to start a residency program. And if you ever shut one down, ACGME will generally not reaccredit you because they see you as too high of a risk to reaccredit you. So there's a risk. If you shut down, you'll never get reaccredited either as a teaching program.
Well, let's lean into that. And you spoke to it a little bit, Clint, but I think, can you speak to specifically, like, what does this actually look like, the lack of stable funding for residents, for patients, and for the community? And I think what I would want to, each of those, residents, patients, community, the impact is significant, but I think it's quite different from, sort of stakeholder to stakeholder. So do you want to unpack that a little bit more?
Yeah, I mean, there's a lot to unpack there, and I know we have a short amount of time. So we'll try. I guess one way to look at it is the cost to run a residency program is one way to look at that. Our residents, cost us anywhere, depending on the number you look at, $210,000 to $250,000 per resident. Right now, the per resident amount that Congress funds is $160,000. So even if we do get funded, we're still underwriting anywhere, up to $100,000 of that cost ourselves, even if we do get funding. So we still are going out raising funds ourselves to train these residents because it's the right thing to do and it's needed. So even if we do get funding, that's not going to fix our shortage of funding. It's not going to fix the shortage of the health center funding that we need. The health centers themselves have not had an increase in funding in several years, as you know. So we need funding that fixes on that side. We're being hit really hard on increases in wages, on expenses. So we're trying to deal with that. Our National Service Loan Repayment Program needs fixed. Our 2 doctors on here now are, they show that works. So our workforce there. We've recently, there's just so many funding pieces we're being hit on all at once, and we're trying to make it work. But our margins have gotten to where they're this small. So El Rio is probably one of the most healthy financially health centers that you will see. But we're at this point that our margins are almost gone. So I think Hearst even talked about this at the last community health, the CHI, that they have never seen it before. But for last year of 2024, expenses outpaced revenue for all health centers put together for the first time ever. I think we need to take that serious, as a health center program. Hopefully Congress will take that serious as well. And what, ACH is asking for, and even NAC is asking for, is a smaller number, but what ACH is asking for is not an unreasonable number. That number is not asking for a huge investment to blow up this program. It's an investment just to stabilize this program. And we're taking care of, basically 10% of all Americans for a tiny investment.
Yeah, well, and just to pull that through a little bit more, I think, and there's actually another question here that I want to raise, but the uncertainty, obviously there's huge impact in terms of the sustainability of the program, and, huge credit to you guys for being creative and figuring out how to continue even with the uncertainty, but there's no long-term solution there. And I think the shortages in the space, for quite some time, I think primary care provider shortages were felt more heavily in underserved communities, be that rural or urban. But I think it is reaching a different point now where it is literally going to hit everyone. And so health centers now play an important role in that. But I think concerted investment, to your point, Clint, I think making good on the intention and the promise that was made to really see this program not just sustain, but expand. But I think there's a patient component to this as well. If you lack providers, including new providers that are being trained, then that impacts patient access. That's longer wait times. That's, delays in terms of being able to get access to the care that they need. From a community perspective, this program is supporting the training and education of clinicians, but I think it's also helping to fuel the community. It's helping to support patients and all of the needs that they have. So there's a ripple effect across all of this that I think sometimes gets forgotten in the conversation around resources and policy. But I also just want to pull out that there's a specific strain with the uncertainty of year-to-year funding. And I know you said that there's no shortage of folks that want to, train. There are no shortage of residents. But when you talk about uncertainty, have you seen that as is there an implication there? Because obviously you mentioned it, there's matching that goes on and people are making decisions about where they're going to go. So what does that look like in the context of this?
Yeah, interestingly, we've not seen a shortage in applications, and we had over 800 applications for our program. So there's no shortage in applications. When we open up those applications, people want to come train in a community health center, and in particular coming to El Rio because they know that whole person approach that we have. And in particular, they want to come train in this type of environment. I think, they really see the value of a health center and our learning experience here in the community health center program as a whole. So I think the more slots that we can open up in health centers, in El Rio, selfishly, we want them to come train with us, but in community health centers everywhere, residents want to come train in this environment. They want to work in the community health center environment. So I think that the more we can open it up, we'll have no issue getting residents to come train with us. They see the value in there. And there's a particular type of resident we look for, that really wants to come here. And you can see that. And then when we interview them, and Felipe can probably talk to this a little more, but we can tell really quickly. So all of the 700, there's a lot of them that we can tell would not fit into that environment, but there's a particular set of residents that really do.
Dr. Do you want to chime in, or Dr. Spegman?
Yeah, I was just going to chime in if you don't mind, Doug, and then maybe you can go. But I was just going to second Clint. I think we're so happy with the residents that matched with us this July. They're incredible residents. They're mission minded. They want to stay here, as you saw in the video. Just incredible. And I will say, just kind of backing up a little bit to the funding. We've been transparent with the residents about this when we're interviewing, right? We said we're part of the teaching health center. Hospital-based training usually doesn't have these struggles of funding or knowing if they're going to be funded next year. They're usually funded. But I will say, kind of to some of your questions you asked, Amanda, is it does affect our ability to recruit when there's uncertainty, right? When they know that it's up to Congress to authorize their training, what's going to happen. And we do reassure our residents that we will do everything possible and look at every possible funding source to make sure that we keep our programs open, but it's still on the back of their minds, right? And so it is becoming more challenging to recruit somebody in a rural site or an underserved site when funding is uncertain, because what if it does close down? Maybe I should choose a different specialty. Maybe I should choose more an urban hospital-based one. just for my own career. Like maybe that's what I should do. So it is a big challenge.
I would echo those comments. There are two things that I would say to what Felipe was just saying, that and Clint referred to it. The timelines are not in sync. So we stepped up, we committed, and despite not getting funded, even though we got funded through HRSA dollars to set up this residency, we never then got the funding to sustain it because of the CRs, as Clint said. However, now we're at nearly going into year 2 of planning, meaning that very soon this would be our second year going into the match. And again, it doesn't align and there's uncertainty. And so young medical students might say, my tolerance, risk tolerance is even though this is where I would want to be, and our applicant pool says that, especially in psychiatry, that there is such a desire to be trained in a community-based psychiatry program. And so my last point will end there. These are stories that we all deal with every day, but I'm thinking of two families. One whose daughter tried to commit suicide just the other day and is in a psychiatric facility and working through that. Another who tragically, their son in his mid-20s was just found dead from an overdose. And these are the real crises of our communities. Our residents in psychiatry, with the opioid epidemic, with the epidemics of depression and anxiety that we're seeing, our programs are also allowing us, our community-based hospital was not able to really feel that they could adequately stand up their inpatient facility. We stepped in that space as well and said, this is where our residency programs can help and can train also crisis intervention, in hospital based psychiatric services, and very importantly, outpatient psychiatric services. The thing, Amanda, that it's hard to lead sometimes clinically, administratively within the community health center movement when everyone says, we get it, and you guys are the solution. And that yet, when push comes to shove and we stand up the programs, we don't see that promised support coming through.
I get it, Dr. Spegman. Obviously, most of my career, pretty much my entire career, is trying to address exactly what you're getting at, and the power of advocacy and the importance of the collective voice across the health center space. And this is definitely one where I think it does require that very unified chorus. I think there's a lot of folks, ACH obviously is doing a lot of work on this in DC. I know you guys have been extremely active and others in this space, but it is hard. And I want to acknowledge that. I think that we do hear that consistently, that there's understanding and recognition of the value and the importance, and it's bipartisan, and all the pieces are there. But then when push comes to shove, it's just sort of like, okay, but what's getting lost? And so it's a really great segue actually to the next question that I have for you guys. And I may tap Clint to sort of tackle this one first, although I think all of you probably have something you'd like to say. But in the context of this conversation and the situation that we find ourselves in, what would you like policymakers and the public to understand about the stakes of this issue? And what is the message that you would say sort of at the end of the day, what is the the thing that they need to understand and the action that needs to be taken?
Yeah, I think we'd like them to understand the real world consequences of these actions that they're taking. It's these policies and these things that they're doing, these CRs especially, have real world consequences and long-term consequences. These are not short-term things. These 2-month kicking the can down the road have long-term consequences, especially right now. If they do another 2-month CR, a lot of health centers are not going to go into the match. Even probably some of these 15 that are in right now will pull out. So we'll lose more residency programs that permanently shut down. So a 2-month CR is going to have permanent, implications on some of these residency programs. So these things, and they'll come out, publicly, a lot of politicians and say, it's flat funding. There's no, it's great. No, it's not. It's not status quo. It has long-term permanent consequences. So we need permanent solutions. We need a real budget. We need the adults to sit down in the room, have a conversation, and solve these problems, and have real long-term solutions. Health centers are part of that solution in the healthcare side. I think everybody would agree with that. Both sides of the aisle. I've not heard anybody say the health centers shouldn't be at the table as part of the solution. So let's do it. Let's sit down, have that real conversation, and not take politics out of it. Let's have some real conversations and get some of these problems solved, and stop some of this partisan politics. I think we've seen what happens when that, happens, and we really need to get some solutions put in place. Telehealth is another great example. Telehealth keeps getting kicked down the road. We've had to give some of our telehealth staff notices of possible layoffs, I think 6 different times, because those rules keep coming up. We have to give a 30-day notice to our staff. We've done that multiple times because we got within 30 days of those rules falling off. Congress will come up and then say, oh yeah, we fixed that within 2 days of it. So there's no problem. There's real problems to these things that they're causing to their constituents, to us as providers. These have real world consequences. They're making our lives to operate as medical providers very difficult. Not just health centers, as medical providers. It's hard to provide care to our communities in this uncertainty.
Well, I was going to add to that when, and I'm so, it's heartbreaking to hear that you guys have had to make that hard decision to give that notice based on, the potential inaction that is needed. I hope my hope is that people stay on, but from a retention perspective, it's very, very difficult to know that your job is not necessarily completely secure and stable, and that funding is going to be there. From a retention perspective, I'm sure that that's really, really challenging. You're asking a lot of the individuals to take that leap of faith that it's going to be okay. And I think you mentioned this before, Clint, that, El Rio is among one of the most stable in the country in terms of health centers and your ability to kind of forge ahead. And that's one of the realities for health centers. We're you all are masterful at figuring it out, and that is part of the legacy of health centers and something that I think we can all be very proud of. But that cuts both ways. And I think this is a great example of that, where you can only make it work for so long before something breaks. And I think, talk about in this environment where I think there is so much attention and emphasis being placed on sound investment and being good stewards of resources, and where there has been, at least some effort to invest in the program, to support the planning, to get you guys to where you are, and the other 15 to 18 health centers that are right on the brink. But to see that potentially fall apart, all of that work, all of that investment, all of that progress is not just heartbreaking, but also I would call that somewhat irresponsible. And so I think the time for action is now. ACH's ask is $300 million a year in investment for 3 to 5 years for the teaching health center program. But to your point, Clint, the pieces that I would call out is that it needs to be a consistent and concerted investment for a duration of time. And that has to do with the way that the program functions. I think you guys have outlined that really well in the conversation today. But Dr. Perez or Dr. Spegman, anything else that you'd add?
Sure. So I'll say a few words, just kind of echoing what Clint said. I truly believe in my heart that our national leaders have good intentions. They want the best for our country. They want the best for our community. They want the best for our people. And I think in times that we're going through right now, I think maybe there's confusion between cutting cost versus investments. And if we're not investing in the future of our people, in the future of our country, in the future of our healthcare, it's going to crumble. And so really, instead of just cutting or doing flat funding, really looking at those important pieces that do need to get funded, do need to get expanded. Us as the conditional awardees from HRSA, we need that funding. It's not going to be sustainable to keep this program training our doctors where they need to be trained so they stay in those communities that they want to stay at. We need them to kind of step up and really look at the big picture and invest in our country. Those are my words.
Yeah, and Felipe, that's so well said. I would add this and maybe make this a very pointed ask, because there are a lot of competing interests, and I understand that. We all do. But if people understand the benefit of community health centers for communities, constituents within their communities, I'm specifically asking congressional help, congressmen and women to step up to help us with this particular issue. 15 to 18, whatever that exact number is, of federally qualified health centers. And we know some of them very well, from Hawaii to Washington State to New Orleans, Utah, Pennsylvania, programs throughout the United States that we know these folks. They, with us as federally qualified health centers, have stepped up and are standing in the gap. We need congressional help to really say to HRSA, we need to include these programs that already are training without this funding, to include them in any continuing resolution that may be flatlined. We need to be included in that. In any notice of award that comes out that says, hey, we're really concerned about the 87 to 90, however many there are, teaching health centers that currently exist. We're in a limbo state where we're not recognized as existing, and yet we have done the work and are training the clinicians of tomorrow. We need Congress to say, recognize them, include them in any of these budgetary continuing resolutions or new notice of awards that come out.
So I will just tie a bow on that, if you will, to say that we need congressional action to build on the incredible success that's already underway with the Teaching Health Center program. And that includes specifically those of you in the situation that I know El Rio finds itself in, where an incredible amount of work and planning has gone into the continuation of this. And so, as I said, there's a lot of stakeholders working on this. I know you guys have been really active, but I hope that the message that others in the community, in the wider healthcare community, can take away is how incredibly successful health centers have been and can continue to be in providing this training and education, how desperately it is needed when we think about workforce shortages and how we can continue to meet that need, but that there does need to be additional investment. And I think I'm going to call out the word opportunity, because I think this is an opportunity to really invest in the bigger vision for the future of the healthcare system around Make America Healthy Again, but quite frankly, just refocusing on primary and preventive care, to really lean into where we should have always been leaning into in the healthcare space, which is keeping people healthy, bringing people into health, treating the whole person, but also training the providers to be in the best position possible. And there is no better place to do that than health centers. So the ask, again, for the Teaching Health Center program is $300 million a year for 3 to 5 years. That needs to happen immediately. If it can ride on a continuing resolution, fantastic. But what we need to see is that action to make sure that there's sustainable funding. I just appreciate so much the conversation today, but also the incredible work that all of you are doing, the model that you've established, your perseverance to keep going in spite of all the challenges and the uncertainty in the space. I encourage everyone who's been listening to the conversation and finds themselves inspired today to help us to take action on behalf of the Teaching Health Centers program, to be in touch with your congressional members, to ask them to make that investment immediately. We're right up against the clock right now. This is an issue I expect will continue for a little bit. I don't think even with the clock running that we're going to see an immediate solution. So this is a conversation and a call to action for some time. But again, I just want to thank you so much, all of you, for the work that you're doing and the beautiful model that you've built and established at El Rio. And we'll look forward to having you back to have a conversation in some period of time to hopefully be able to say, you know what, we're thriving. The uncertainty has moved away and here's what's on the horizon. So, but thank you guys so much today and for everyone for joining us today for Community Health Centers Unfiltered. We look forward to being able to talk with you again in the future. Have a great day.